And welcome to the Healthbeat Show. I'm Dr. Jeffrey Watson. Welcome back to the Healthbeat Show. We haven't seen you for a while. A lot has been going on, as you know. Today, we are talking about the African American physicians and African American patients. We're going to talk about racism. We're going to talk about the legal aspects of healthcare. And so I have two wonderful people here with me today. One, none other than Dr. Ralph Peterson, gastroenterologist. Welcome to the Healthbeat Show,
Thank you,
Dr.
Jeff.
Peterson. And none other than Attorney John Burris, who's one of the nation's top civil rights attorneys, has been involved with lots of cases. We're just talking about it. He's recently met with the new chief of police and has talked about the Ryder case and all other types of things that he's been involved with. But today we're going to be talking about some of the aspects, the challenges that black doctors have in healthcare. And so, Attorney Burris, we know that in all kinds of industry, you've worked with UPS, you've worked with other companies in which the employees and others have had all kinds of problems. We have problems just trying to be a physician as a black man or woman.
Mm-hmm. Well, I can appreciate that because you're right. Unfortunately, the issues of race manifest itself in all kinds of professions. And for those of us who work and dealing with people, we understand and see that even more. So why don't you tell me, Dr. Peterson, about what your sense about whether or not African-American doctors are treated differently than other doctors?
Yeah, we treat it differently, unnecessarily so, because one of the jobs that we have is after we finish medical school, major or specialize in whatever we specialize in, our goal then is to come back to the community. And I came back to Oakland, which is where I'm from. I went to high school here, junior high school, elementary school. So I came back to the community and just saw a need that the community have that I can be able to fulfill. I did internal medicine initially, and then I started doing gastrointestinal disease, which is my subspecialty, and started receiving quite a few referrals from doctors like Dr. Watson and so forth in the community. My goal is to help. Mm-hmm. But sometimes just things get in your way. The medical boards come after you for no reason. You're saying, why am I even talking to these people? I remember they came after me for a particular case. Nobody's ever got injured. Mm-hmm. Just want to say that. Mm-hmm. There's no danger there. Want to say that too. It's like, are you over-prescribing certain things? Are you doing things that you shouldn't be doing? Did you treat somebody for a stroke who went to the hospital the day before and they didn't keep the patient? She comes to me with a stroke. And I said, oh, wow, you have a stroke. I need to send you to a neurologist. It's a completed stroke at this point. And next thing I know, I'm being involved with the medical board. I can have a public reprimand behind that because it get costly, as you know, to fight things like that with lawyers. And I did the fighting. Then after you start reaching a certain number, they say, hey, either we can settle or you got to keep paying. I said, let me settle. I can't keep affording
Well, you know,
this bill.
I have to say I've had a lot of experience earlier, and particularly early in my career, representing doctors who seem to be unduly put upon a challenge by the California state Medicare people, Medi-Cal. And it was always befuddling to me. And so, Dr. Watson, have you had a similar kind of experience dealing with the Medi-Cal state of California?
Oh, of course. And right now I'm dealing with that. Mm-hmm. When I would go to the hospital, first of all, people followed me around from the hospital administration. And they looked at my charts, and I seemed to get letters and phone calls that other doctors didn't seem to get, the white doctors didn't seem to get. They said I didn't answer the phone quick enough. And some of the doctors who claimed that I didn't, I called them and they didn't answer the phone at all. Mm-hmm. You get letters from Medicare and Medi-Cal to ask if your service to them is medically necessary. Mm-hmm. You know, can you even find the definition of medically necessary? What if a patient wants you to see them? Is that medically necessary? What if a patient has high blood pressure or diabetes? Is that medically necessary? Or what if a patient you think could have cancer and you want to test them like Dr. Peterson does, colon test and endoscopies and so on? Is it medically necessary? Well, studies have shown that a black patient seeing a black doctor is going to get more preventative tests than they would if they went to a
Well,
white
rightfully
doctor.
so, don't you think?
Yeah,
I
I think-
would think that one of the values of having a black doctor, certainly I've had one, namely you, for 30 years or so, but my other doctors are all African-American doctors, and so I think that's important. But what's your sense about that, Dr. Peterson? You're an African-American doctor. Do you think your patients feel better in terms of coming to you versus going to a non-African-American doctor?
I trained in DC General Hospital in Washington, D.C. And one of our mottos there was, when a patient comes to you, you better have more than 2 or 3 diagnoses. So you start digging for other problems that the patient may not express to you. They may have come just for high blood pressure. Then you do a blood test, find that they have diabetes. You do another test, find that they have fatty liver. And you do another test, wow, you may have hepatitis. But they only came to you for one reason. So we started digging. That's true in my practice today. When a patient comes, I look for more problems.
And also, there's a greater level of trust and comfort. You know, in the healthcare system, from 1932 to about 1972, the Tuskegee study went on. They gave African American men syphilis. Didn't tell them they had syphilis, but followed them for years and years to see what the effects of the syphilis was. So there's distrust with the healthcare system, but patients will trust African American physicians. We saw that recently with the COVID vaccine. You know, we thought that the COVID vaccine might have syphilis in it. It might have something bad in there that's going to hurt us. So we found that African Americans trust each other, and it's like if you only spoke Spanish, you'd want to go to a Spanish doctor or a Spanish-speaking doctor. If you spoke Tagalog, you'd want to go to a Tagalog doctor. African Americans, we know each other's culture. As Dr. Peterson said, we also know that there are greater risk factors in certain areas. And so we go further. We go farther because one doctor told me yesterday that if he went to a white doctor, they wouldn't even touch him. I mean, they would not put their hands on him. They wouldn't take his blood pressure. They wouldn't take the pulse. They wouldn't listen to the heart. So I thought that was pretty interesting.
You know, there's been a lot of studies that demonstrate, particularly in the area of healthcare in terms of OBGYN, women healthcare, that no matter, regardless of how professional, how educated a black woman is, her outcomes is less than those of a white woman who is uneducated. Just startling kind of data. And so the question, do you see that in terms of in other areas of the practice, other than that's the female side of it, but in other areas, do you see this whole sense that African Americans' outcomes are not as good when they have white doctors versus black doctors?
I'll say for me, patients come to my office referred by other doctors, and sometimes they demand to see me, but they may have been to 4 or 5 other GI doctors, and nobody's found their problem.
Right.
I would sit down because we know that 80% of the problems can be determined by history and physical examination. So I would sit down and talk to the patient and just dig deep, being culturally sensitive too, and I find out their problems. And then we deal with it. We order the necessary tests, we try treatment, they come back. Now, one of the things that I do in my practice, I have them come back sooner because I want to know if the effect of the medication has worked. I just don't say, I see you in 6 months or 3 months. No, you come back in a week, or I call you in 3 days. And I find that it's much better than get trust from the patient, but my goal is to help the patient.
But the insurance may refuse that too.
They do.
As Attorney Burris has indicated, they refuse that. They think you're doing something wrong because you are doing something extra. And one of the things, I just recently read an article in the New York Times. It was a research article. Never in the history of America have blacks outlived whites. They never have lived to the same age group. They've never outlived.
That's shocking.
Yeah,
That's
never.
surprising.
And so some of that, there are a lot of social determinants, a lot of economic determinants, as you've talked about, but some of it has to do with the health care that's given by others to them.
So what's going to happen to the African American population as you see the system comes down harshly on African American doctors, some of them being driven out of practice, some of them not being driven out? The question is, what happens to the patients who are left? Where do they go? You know, these black patients who are being covered and taken care of by black doctors, what happens when the black population of doctors is diminished for all kinds of reasons that result from the medical boards or the state of California, whoever, coming down harshly on them?
It's something I've been wrestling with right now because I've been saying, I'm going to quit, I'm going to quit, I'm going to quit. But as I think about it, I say, oh, what's going to happen to the patient? Because, look, I scope a lot of African-American male colonoscopes. If it weren't for me, they probably would never have it done because I make them feel comfortable. They know I have their interests at heart. I tell them that they're the most important patient in this surgical suite. You're very important. I want nothing to happen to you. And so I get a lot of patients that way that I perform endoscopic procedure on. And thank you for the referrals, Watson. But I don't know what's going to happen because I have not quit medicine for that very reason. I'm still trying to find another African-American GI doctor who want to come to the Bay Area.
I agree with Dr. Peterson. What's going to happen to the African-American patients if the African-American physicians aren't here? I'm Dr. Jeffrey Watson. We're here with attorney John Burris and with Dr. Ralph Peterson right here on the Healthbeat Show. Stay tuned and we'll be right back.
Man, it's lonely. Going through life lonely.
There is the therapeutic aspect of music.
And we are right back here on the Healthbeat Show with attorney John Burris and with Dr. Ralph Peterson. Attorney Burris asked, what is going to happen to the black patients if the black doctor number continues to diminish, if they have legal obstacles, if they're not able to practice or they retire? Excellent question. And Dr. Peterson has said that's one of the reasons that he didn't stop. I've had legal challenges, as Dr. Peterson has. I could have succumbed to them in 2019, but I decided I would continue to try to fight because of the same thing that he said. What black doctors are going to take care of our people? There's not a lot of African-American physicians in private practice. You've got people moving over to nurse practitioners and physician assistants. You've got the socialization of the healthcare system with big systems like Kaiser and so on. But I don't know that they even have enough African-American physicians.
So then what's going to happen to the patients? In light of
We're
the fact
gonna-
that the diminishing
But you know,
doctors.
Jeff, the study's been done already. Wherever there's a dearth of black physicians, not enough of us, black people live less. They don't live as long. But where there's an abundance of black physicians, black folks live longer. We have an interest in our people surviving. I always tell my patient, I don't want you dead, because if you're dead, I can't get paid. I want you to live as long as you can. My goal is 150 with all my patients, by the way.
But we haven't really answered the question yet. And the question is, what's going to happen? The thing, if you cut off the head, the body dies, okay? So if either from a political situation, a legal situation, or our health or economics, we can't be here, it's going to result in worsening outcomes for African Americans. There's no question about it.
You know, I have kind of a personal situation that I always thought that had a racial tinge to it. I have a stepson, early 40s, had pain in his back, and went to the doctor. This is a major hospital in North Carolina. They sent him home. But he continued to have the pain in his back. And he went the second, third time, they continued to send him back, and they sent him with aspirins and stuff like that.
I thought he wanted dope.
They thought that he was looking for
Narcotics.
And he didn't do narcotics. And this was a very clean living guy. And it wasn't really until his mom, my wife, ultimately went to the doctors, picked him up at the house, and took him and would not let him leave until they ultimately examined him. It turns out he had cancer. And the cancer was gone in such a way that it had gone far enough that there was no return. I mean, they did a lot of other stuff. But if they had looked at him early, at the very stage when he first complained, they might have been able to do something about it. And that's an example of what they say, that black people do not get the early treatment they deserve because doctors are unwilling to give them due consideration at the beginning. Have you guys seen any of this in terms of patients coming to you?
All the time.
All the time. Just recent, very prominent person in the community. He come in with this right upper quadrant pain, and I'm trying to figure, had a colonoscopy, had an upper endoscopy, had an x-ray. I said, we need to do something further. Let's do a CAT scan. Most people would have stopped, but I was curious.
Yeah.
And he had cancer of the liver. hepatic cellular carcinoma of the liver.
So do you-
But we caught it early.
Yeah.
That's the beautiful thing. When you catch stuff early, you can get cured.
One of the things that's troubling, and you guys can speak to this, is now that we have managed care and all the various ways that you have to get approval, have you really seen that whether or not these companies, insurance companies, are fair in terms of their willingness to readily give the kind of authorized treatment to patients that you request of them early, or is there a problem? Or do you feel like they don't respond timely?
There's a problem. They don't respond timely. And another key factor is some of the managed care companies won't even let the black doctors be on their panel.
Right.
So you can't go to use your insurance to see the doctor that would advocate for you. So you may have to wait, as Dr. Peterson has said, go to somebody that doesn't care for you that much. I've had patients that I was very concerned. I sent them to a specialist, and the specialist said, "You don't need the test. I'm not going to do it." Mm-hmm. And I had a patient come from one of our prominent HMOs. He came to me. He was seeing other doctors. He had prostate cancer. His PSA was over 100, okay, and normal is 4. And I said, well, what did they, at that hospital that you go to and saw a Caucasian doctor, what did he say? He said, you're going to die, you need to get prepared. Mm-hmm. Mm-hmm. And I started him on some medication that were just pills that I had done some research with, because, you know, we do a lot of evaluation of prostate cancer and so on. His PSA dropped from 100 down to 60, down to 40, down to 20. And he just really wanted to know, why did that doctor tell me that? Some of the HMOs feel that they will save money by not doing anything. Yeah. And so they save money for the company. Then you get a situation where the Affordable Health Care Act said that if you keep patients out of the hospital or give them less treatment, we'll bonus you. Mm-hmm. So the big people get away with this thing called kickbacks. They get away with it.
Keeping them out of the hospital. And
Keep them out of the hospital, they get a financial incentive, which is really some form of a kickback. But you can't tell that to the big-time lawyers that would be after us.
You know, back in the day,
let me just echo one thing, and I agree with you absolutely. My problem has been getting into the insurance company so patients can come to me.
Right.
It's the new exclusion system, and they will say to me, "You're in the wrong location. Not enough patients in that area." I have people coming from Sacramento, from San Jose to come see me, so I couldn't be in the wrong area. It's a way of excluding me from that particular insurance, so the patients no longer can come to see us. And it takes about 45 days to drop one insurance, which is what we tell them. They pick up another one that's more favorable for me, and then I can see the patient.
So do you think this is about competition, though, in terms of making it more difficult for the black doctors in order to increase the economic earning power of the white doctors?
I think it all comes down to dollars and cents. I really do.
It does.
Yes.
But there's also two things I want to say. There's also what we would call an unconscious bias.
Right.
Unconscious bias. I love black people. You guys are really nice and all that kind of stuff. But unconsciously, they can't, you know, you go back to the doll study. You know, which doll is the good doll, the white doll or the black doll? Well, the white doll's good, not the black doll. Whose ice is colder? Well, the white people's ice is colder. That's why I like that drink. So it becomes an unconscious bias issue that they would try to keep him or me out of certain situations. Now, you just talked about, you met the new police chief, and that there is a greater bias towards blacks just driving down the street. They get handcuffed more, okay? Just driving down the street, treated brutally. We get handcuffed more than do Caucasian doctors. One other thing that you said, very, very, very important, your wife advocated for the son.
Right.
And when you ask what's going to happen, I think we have to encourage and train people to be advocates. And I know Dr. Peterson and I, we both get called all the time by our friends or by somebody. And you know, this show used to be a call-in show, and when we were on KDIA, it was a call-in show. And we would advocate for people. We would tell them what you need to do. You need to say to them when the stepson was having a bad back pain. He needs an MRI, he needs an x-ray, he needs certain blood tests. It's not just about pain. The opioid war for prescription opioids killed more white people, but black people can't even get a pain prescription because they think that you're bad, you're a criminal, you're a drug addict, all that kind of thing.
I just also want to add to advocacy, which is big in my practice, because they know I'm going to tell them the truth. They know that I will refer them to the right doctor. If I don't understand it, I have connections, Stanford, UC San Francisco, wherever I need to get this patient better. And they're not there by themselves, they're there with me because that institution is required to send me notes, but I'm going to read and discuss it with the patient. So I had a patient call me. I was in New York catching some shows and trying to relax. He called me several times. Let me call my answering service. And I finally called the patient. She was having an event. She had diverticulitis that had popped open. She had an abscess. Now she had to maybe have surgery. They said, no, we'll send you home, and if you're worse tomorrow, come back. She called me and said, no. Go to Sutter, tell her where to go. Tell them you can't eat, you got this pain, you have a history of diverticulitis. They have to do a CAT scan. They did a CAT scan, they saw that big old mass. They did emergency surgery. She's alive today for that reason. If I had not advocated for her, she'd be dead.
But we, just like Attorney Burris has said, we have to figure out some way to train family members and others to be advocates, because if we're not here, if there's a reduction in the black doctors, there's got to be family members that understand that something's wrong, and they've got to advocate, just like your wife did, to go out there and make them take care of the people.
Well, you remember when I was in the hospital, I had advocates, you know. But for the advocates, I don't know what would have happened, you know.
Yeah,
so,
I came to see you to make sure.
Yeah, you were there, and Glenda was there, and of course my wife was there.
Yeah,
They were all being advocates. But the question I have down next, though, is that of a second opinion? Do you advocate the patients to get second opinions, or is there a pool for them to get second opinions? If you have a black doc and you get a second opinion, or if you have a white doc and you come to a black doc, is there anything about this getting a second opinion that you recommend or not for patients?
I think it's important if you feel that you're, as Dr. Peterson just said, if you're not being treated right, or there's a situation that could be very serious, or you're very uncomfortable, or you think that you are not being given the best expertise, yes, a second opinion. Now, I know Dr. Peterson and myself have both taken care of people for free and have seen them and answered their questions and gone through it. We then either I'll refer them to him, or I'll refer them to a higher level, like a university place, to try to get that second opinion. Sometimes it takes a long time, though, just like you said, but we can push the envelope and try to get the patients in there. So I think it is important to get second opinions.
Not just that, I mean, I know my limitation. There's certain GI procedures I just don't do. They came after my training, and be that as it may, so when a patient is sent to me, if you send me such a patient that requires, let's say, an EUS, endoscopic ultrasound, for example, and I say, I don't do that. But it's not my job. If I can't do it, it got to be somebody's job. So I make the contact at UC San Francisco. I call them, I personally talk to them. They welcome the patient because they got the data now, and they know what they're responsible for. I said, that's my limitation. I don't do EUS. So we help the patient in multiple ways, even when we have our own limitation. Is how do we help the patient, because it's not about us. It's only about the patient.
Given all of that the referral system is in place, expertise the doctors have, is there still a sense that the black patients are still not getting what they really deserve because of this way the system is laid out now?
Well, I think so, and that's what the data is showing, is that if you were black and you saw a black doctor, the odds are that you would get more preventative care, just like Dr. Peterson, about 34% more, based on a New York Times article. Cardiovascular disease would be 19% less, and you'd have an 8% chance of living longer. So that's a key thing. I think one of the other things that is an obstacle and a real hurdle are some of the legal battles that Dr. Peterson has talked about and that I've talked about. One of them that we're not lawyers. we weren't taught all these legal issues in medical school or residency. One is the Stark Law. Stark Law is basically like if I own an X-ray place, I can't send my patient to the X-ray place. If I can't send
you own it.
Yeah, if I own it, I can't self-refer.
There's a conflict of interest.
Conflict of interest or kickback is what they might call that. But you know, after the COVID pandemic, these laws started to change, and a lot of the things are getting gray now, because there was a great need for people to work together and help each other, and different systems and home health agencies, and all these people needed, you know, I tried to send somebody to your house once and they didn't show up. So I came.
You came.
Yeah,
That's right,
I came myself, right?
You came.
So, but they wouldn't come. So there's all kind of obstacles and hurdles that we have to get over. And I would also suggest that somehow, and I hope maybe you can help us with this, is that the physicians become educated on these rules, regulations, laws that you go to court about and have gone, and Peterson and I have gone, don't know anything about it. We don't even know how to defend ourselves correctly. It's very expensive, don't have the time. So we appreciate you being here with us. We appreciate the great work that you've done in the community and continue to do. We hope that you will talk with our chief of police and try to help things to be safer around here. And we hope that the community will support the black doctors, will advocate for us when we're challenged. You know, now we're in a world where you got the internet and all that kind of stuff, and people put out bad news on you all day long. We hear about all the people that were great, now they got bad news. Even if you're an entertainer, an athlete, or a doctor, a lawyer, whatever it is, support us because we support you. And if you knew better, you could do better. And that's why we're here, right here on the Healthbeat Show. I'm Dr. Jeffrey Watson. Remember always that your health is your wealth. And when you have your health, you have everything.
You have everything.
We'll see you next time.
Thank you.
If you have your health, you have everything.